Hello everyone, I am Dr. Meenakshi Banerjee. I am a consultant in Max Hospital and we have our own clinic at Pelvinic. I would like to today speak on the topic fibroids. I think fibroid is one of the most common tumor we can say seen in the reproductive age group basically. So this fibroid people are very afraid of. It's like a tumor, whether it will cause harm to me or what can it have an effect on myself or my pregnancy, fertility, a lot of questions which arise in our mind. But I feel it's a very underestimated and unknown fact. Most of the people are not aware of the fibroids. They are generally very benign tumors. Almost 99% of the time the fibroid may not cause any problem and may not have any problems in causing cancers or anything like that. But I feel fibroids have most of the patients present with the symptoms like heavy cycles. There might be severe pain during the cycles. If the fibroids are very big, they can have pressure symptoms down there, the lower abdominal pain, and sometimes when they grow outrage the size, they may cause severe pain and the patient can present in emergency. So most of the symptoms are easily treatable by the simple management like a pain relief or a treatment to control the bleeding. But yes, when the pressure symptoms or the symptoms because of it causing the infertility may need to be treated, and you should visit the doctor. Most of the treatment of the fibroid, if they are asymptomatic, they might not require any treatment, just a simple conservative treatment. And if they are causing a problem, might require the removal of the fibroid itself, or depending on the condition, type of fibroids, multiple number of fibroids, they can may require sometime a removal of the uterus. So knowing the exact fact about the fibroid is very important. They can be easily diagnosed with the simplest of the measure like an ultrasound, and if they are multiple in number, probably an MRI will be the best modality to diagnose it. The fibroids are actually of different types, the most common being in the muscle of the uterus, which is we call as an intramural fibroid, and they can grow enormously large in size before they can even show the symptoms. Even the subserosal fibroid, which we say that which is outside the muscle of the uterus, they may remain asymptomatic for long. The most common fibroid which can cause the problems at the earliest, even the smallest of the fibroid, which are indenting into the cavity of the uterus, and patient can have severe amount of pain, too much of bleeding during the cycle, and probably they need attention the earliest than as compared to the others. So a fibroid may have different treatment, probably depending on what type of fibroid is there, number of fibroids, the symptom, the origin of the fibroid. And probably sometimes when it is indenting into the cavity, we might require a hysteroscopy, which is a small laparoscope-like instrument which we insert inside the uterus and see whole of the cavity and what amount of fibroid is indenting inside. Sometimes they may require removal by the hysteroscopy itself. And if they are more towards the outside, probably a laparoscopy, which is a minimal invasive type of surgery, will be the best one to treat it. For any consultation regarding the fibroids and its management, I feel that the right treatment is required, so you should meet with the right diagnosis. Thank you.